Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, the Nigerian Association of Medical Doctors releases report on COVID-19, claims over 300 medical doctors nationwide in isolation. Oyo Police Command to prosecute violators of restriction order in the state when the courts resume fully. And South Korea records first day with no local transmission since mid-February. One painful consequence of the treatment of the coronavirus is the infection of health workers. The Federal Ministry of Health and the Association of Health Doctors have expressed great concern about the huge impact of the pandemic in the treatment of COVID-19. According to the Nigerian Association of Medical Doctors, NARD, 366 medical doctors are in isolation after being exposed to COVID-19. As of this morning, 26 doctors out of that number have tested positive. 5 doctors have also died. Also, another information coming from the president of NARD is that today 13 healthcare workers from the National Orthopedic Hospital, Dala, Kano, are reportedly infected. On our theme today, we find out why the numbers are increasing, the status of those infected, and how we can stem the tide. The death toll from COVID-19 in Nigeria has risen to 51. Total confirmed cases in the country now stands at 1,728, following the announcement of 196 cases last night by the Nigeria Center for Disease Control, NCDC. The center also confirms that 307 patients have been discharged. A look at the state-by-state breakdown showing Lagos with the highest, 931 cases, Abuja 174, Kano 139, Borno has 59 cases, Ogun with 50, Gombe 64, Osun State has 34, Katsina 40, Edo State 37, Bauchi 29, Oyo 21, Sokoto has 27, Kaduna 32, Akwa Ibom 12, Kwara 11, Ekiti, Ondo and Taraba have 8 cases each. Delta, Abia and Rivers, also Jigawa has 7 cases each. Zamfara 4, Enugu 3, Niger 2, Adamawa 2, Ebonyi has 2 cases as well. And we have 1 each from the other states you can see there. Now, Borno State is recording an increase of COVID-19 spread among the frontline health workers. Our correspondent, Blessing Tuna, reports that in one facility, 36% of doctors and nurses have tested positive for COVID-19.
The death toll of COVID-19 in Borno State as of today stands at 9, and this figure was given at the last media briefing. And now the Commissioner of Health has said that all 9 deceased had premorbid conditions, and we also understand that some of them were actually patients on admission at the University of Maiduguri Teaching Hospital from where they contacted the virus. I mean, the index case was admitted there when it was brought in from Pulka in Goza local government area. We also understand that some doctors and nurses of the hospital also got infected, and as a matter of fact, the hospital has said that 36% of those who tested positive in the first instance are staff of the hospital. Now, the Commissioner of Health has said the bright side of this situation that we are in right now is that most, if not all, of those who are tested positive are traceable to a positive case. And what this means is that we are still not at the community spread stage, which is a good news on its own. Now, today is the second lockdown-free day this week in Maiduguri, and you will see that the streets are very busy with residents rushing either to restock or to make business through sales or services that will be required today.
But the max up now in Maiduguri, the max is high. They say the max is 500 naira. So up now we are in house, we are in lockdown now. So we don't have 500 naira to buy this thing. So you see the condition are.
We need to intensify effort and also ensure that the Borno State government strictly engage citizens to adhere to the guidelines. It is so pathetic that at this time, the Borno State government is relaxing or taking off the lockdown for some days, which I believe it will be an avenue for the spread of this virus.
And that's all we have from Borno State at this moment. I am Blessing Tuno Aso, Channels Television News.
Let's take a further look at why we're having a lot more medical workers in isolation and the threat of the pandemic. Joining us to talk some more is Dr. Aliyu Sokumba. He's the president of Nigeria Association of Resident Doctors, NARD. Thank you for joining us on the program. First, I'd like to start by asking why we're witnessing more doctors isolated as a result of exposure to COVID-19 across the country.
Thank you very much. Well, as we had continued to advocate that because of the inadequacy of personal protective equipment across the hospitals in this country, our health workers have continued to be exposed to this deadly disease. As we speak, at the moment, we have 29 doctors who have been tested, who have been confirmed to be COVID-19 positive, while over 377 have been quarantined, having been exposed to a confirmed case of COVID-19. This has continued to corroborate our earlier claim that the healthcare workers across the various hospitals in Nigeria are not adequately protected. And as a result, we have continued to experience more and more healthcare workers, especially doctors, testing positive to this disease. As we speak, again, we have 5 doctors who have died from this COVID-19, cutting across various regions in this country: Lagos, Katsina, Uyo, and Umuahia, and so on. So the point we're trying to make here is that we have continued to advocate and clamor that our health workers are not adequately protected. And this is already manifesting in the reality that these people are coming down with the disease and some are already dying from the disease. And in spite of this reality, we have been promised beyond the personal protective equipment inadequacy. Some governors in the country have taken it to another level to demoralize their healthcare worker. Give you an instance of Kaduna State governor, who earlier hitherto the COVID-19 outbreak was paying his doctors 63% of the agreed salary. And upon his emergence from the COVID-19 isolation, which he admitted profusely that the healthcare workers, including the doctors, have played tremendous efforts towards his recovery, announced a reduction of 25% of their salary. That makes it 75% of the 63% of their salary. And hitherto that, again, the doctors in the state were planning to embark on an industrial action to press home their demand of receiving 63% of their salary. As if that was not good enough, the governor had thought it wise to further reduce their salary by 25% as an appreciation for what they have been doing. Unfortunately, this is coming at a time when other parts of the world are considering rolling out measures to appreciate their healthcare workers and get them more motivated towards doing their best. It is happening that some states, like Kaduna State governor, had thought it that the best way to appreciate his healthcare worker is by cutting their salary by 25%. This is not just happening in Kaduna State.
Right now. So you're saying that apart from having more available PPEs and equipment to work, you're saying that resident doctors should also be paid their salaries as well, and that this will prevent more of the doctors being isolated and then coming down with the virus and dying as a result of that. But I'd also like to ask how much training and education is going for resident doctors on how to handle or work in this pandemic era?
Well, ultimately, the COVID-19 had brought to bear the reality of the poor residency funding in this country. The residency training program, which is a program that produces specialists at the end of the day, the microbiologists, the public health physicians, all the other specialists, anesthetists, has hitherto not been receiving funding for over a decade now, and in spite of the provision of the funding in the Residency Training Act. And this is one reality we've had to deal with. Unfortunately, even the 2020 budget, as we speak, does not capture any form of training for resident doctors. What we have now is a makeshift arrangement, a form of training that has been made available. And of course, you will agree with me that any training that you're putting up may not impact effectively and efficiently as it will have if we had a well-organized program like the residency training program receiving the appropriate funding it deserves. So what we are currently having is a form of training specifically for COVID-19, and I believe that that is also not widespread. It's not cutting across the various hospitals. And as we had continued to emphasize, let us de-emphasize this idea of taking care of healthcare workers at the isolation centers only, because other healthcare workers outside these isolation centers are also exposed, because every patient is a potential COVID-19 patient and they should be treated as such. Instead of focusing on training only a few that will be manning and managing isolation and treatment center, the training should be made available to all health workers across Nigeria, because all health workers are exposed. For example, now in Kano, all the doctors working in Aminu Kano Teaching Hospital, all the doctors working in the National Orthopedic Hospital, Dala, are exposed because the patients coming to the hospital don't have it written on their forehead that I am a COVID-19 patient or not. So the training should not be just for those working in isolation centers and treatment centers. It should be decentralized, and the government should ensure that all health workers are trained with this reality that all health workers are exposed as a result of the community transmission of the disease.
And then perhaps we should also have frequent testing for those on the front line. We appreciate your time, Dr. Ali Sekumbo, President of NAR. Thank you for joining us on the program.
Thank you very much for having me.
The European Union has commanded distribution of food items to vulnerable households in the Federal Capital Territory. The head of the EU delegation to Nigeria and the ECOWAS, Ambassador Ketil Carsten, explains that the intervention is targeted at over 1,000 vulnerable households. The ambassador was speaking at Karimajiji community, where he says 25% of items targeted at people living with disabilities and 75% for widows and other vulnerable persons. The Borno State Police Command says all those who are arrested for violating the lockdown order will be prosecuted once the courts are back in session. The Commissioner of Police, Mr. Shina Olukolu, explains that many are not obeying the sit-at-home order, but that the police will continue to ensure enforcement.
Many people still see the curfew as an inconvenience, forgetting that it's a law that must be obeyed. The police have strategy in place to ensure that the curfew is obeyed. You will recall the AIG Zone 11 was also here in Oyo State to monitor what was going on. And I want to again seize the opportunity to warn members of the public. The others who are not at essential duties should remember that the law needs to be obeyed, and the police will do all within its powers to ensure that the people obey the law. And for the avoidance of doubt, we have effected arrests, but because the courts are not sitting, they should remember that even while they are on bail, they are not out of prosecution.
Borno State has joined the list of states in the northern region that have evacuated 59 Almajiris who fled from the far north into the state on Sunday night back to their states of origin, Bauchi and Katsina, following their willingness to return home. The Borno State Deputy Governor and Chairman of the State's Action Committee on COVID-19, Mr. Benson Abono, disclosed this after supervising the evacuation process.
These young men you see around here, majority of them have entered the vehicles already, are from Bauchi and Katsina states. They were brought into Makadi here. They arrived here a few days ago, about 3 days ago. And on the same day, we were alerted that these young men were around, and for a whole day they were homeless. They had nothing to do. In other words, they had actually violated the federal government stand on stay at home. And we came up here, I interviewed them, and we were made to understand that they came here to look for greener pastures. And this is not the time to do that, because everybody is supposed to be in his or her home. And so I asked them if they were willing to go back, and they gladly accepted. And so the state government has made available these buses which you see here, and they are conveying them, 17 of them to Borno State, and 42 to Kaduna.
Still to come on our COVID-19 update, how to cope with life living the new normal following the lockdown restriction ease. That's in a moment. Welcome back to the program. We had earlier been speaking with the NARD president, Dr. Aliyu Sokomba, that's the president of the Nigeria Association of Resident Doctors, who had a number of things to say with regards to the medical doctors in Kaduna State and indeed their salaries being slashed. Joining us via telephone now is a special advisor on media to the Kaduna State Governor, Mr. Muyiwa Adekeye. Thank you for joining us at this time. You heard what the NARD president had to say. What's the situation in terms of the salaries of resident doctors in Kaduna State?
Thank you very much for giving me this opportunity to clarify. Hello?
Go ahead, we can hear you.
Okay, thank you very much for this opportunity to offer clarification. The governor of Kaduna State, alongside many of us officials here, have many reasons to be grateful to the medical professionals in our public system, the medical doctors. And upon this discharge, the governor has supported the Ministry of Health to develop what is called occupational incentive for medical doctors and other frontline health workers. This includes an enhanced daily package of payments for their sterling efforts in helping the states to manage the COVID-19 pandemic. Apart from this enhanced pay, there is also an insurance package with life insurance and disability insurance packages that the Kaduna State government is paying extra premiums to leadway assurance to guarantee for our medical professionals. So that is the position as regards the concrete expression of gratitude for professionals. On the second point about the doctors, these COVID-19 reductions are across the board in the entire public service of Kaduna State, whether political appointees or other public servants. This is meant to ensure that what is called solidarity happens. It has got nothing to do particularly or specifically with medical doctors. It applies across the board to everybody, all the 100,000 persons that are employed by the Kaduna State government. It is
percentage. What salary is being cut across board, which includes the doctors as well? They're talking about solidarity. What's the percentage?
Every public servant in Kaduna State is making a contribution to ensure that we can take care of those who are not fortunate enough to earn an income during this lockdown. It is not an action directed against any particular professional group. It is across the board, political appointees, public servants. But for medical professionals, there is an occupational safety incentive and the new insurance package payable from April 2020.
All right. We would like to thank you, Mr. Adekeye, for your clarifications on that particular matter. Joining us in the studio is Dr. Mariam Ashodi, public health physician. Thank you for joining us at this time. We're seeing a lot of talk about medical doctors, healthcare workers who are now, really exposed to the pandemic as frontline workers. First, I'd like to ask, how regular is testing for frontline workers?
Okay, well, first of all, frontline workers aren't only people concerned about managing, contact tracing, or case investigation of COVID-19 patients. Every healthcare worker at every health facility, health institution is a frontline worker. And it's very important that healthcare workers that notice that they have been exposed or they have had contact with individuals who have been positive or suspected cases should actually go for testing. At the moment in Lagos, there are over 20 sampling sites in each of the designated local government areas, which in their numbers that you could call and then you get an appointment fixed and then individuals are scheduled so that to avoid overcrowding and all that, and then you come for testing. Likewise, at NIMA, the Medical Research Center, you could go online, going through their website, www.nima.covid.com.ng, and then you could register online. You'll be given an appointment date, and then you could go for testing. It's also very important that because your tests, the test of your results starts from, your result is valid till the moment you were tested. You could test negative next moment, and next moment you would have gotten infected from.
So the thing is, because we don't have a lot of, healthcare workers, doctors, nurses to cater to the population that we have, should we make it compulsory that, doctors, health workers on the front line should have a regular testing maybe once a week? Do you think that would help? So we don't get to see a lot more workers, in isolation?
Yes, in as much as it will help, it will still stop the fact that healthcare workers need to be protected. Because even if you get tested, you're still going to go back to work. You still need to attend to your patients. Every individual is a suspect, so you still need to get back to work, attend to these clients. And it's not even making it compulsory. It should be highly encouraged that healthcare workers should, as much as possible, try to test as often as possible.
About life as we ease into, gradual ease of the lockdown from Monday. What would life be for Nigerians? What should they expect? And, it's also a precarious time, seeing as we're still, trying to prevent the further spread of the pandemic, even though we're seeing more cases each day.
Most Nigerians, or let me put it at Lagosians, they are really excited. They want to go out. It's been like being locked in for almost 4 weeks. But now we have to be very cautious because we keep getting increased number of positive cases, getting them to the health facilities, to isolation centers, and then we're still doing contact tracing, trying to line list those that they've had contact with, and also case investigation, sample collection, awaiting results, and now there will be so many people out on the street. Good, Lagos State government had the press release yesterday, which is still in a bid to curtail the release of the lockdown. They've been trying to, at least part of things that the governor mentioned yesterday was that for health essential services will still be provided, but public service workers, grade 1 to 12 will still be at home, while grade 13 and above will still work. And even for commercial vehicles, for tricycles, they're supposed to have only 2 people in the vehicle, and then for the buses, it should not be more than 7. But now the question is, how well will people comply? It's supposed to be curfew from 8 p.m. to 6 a.m. Are people going to really adhere to all those strict measures? Yes, well, they also put in measures for whistleblowers. So people, when you notice the organization or some other individuals are not complying, you could call in to mention that, yes, these people need to be they need to be arrested or something. Right. But the enforcement needs to be real and people need to comply.
All right. We appreciate your time, Dr. Mariam Mushodi, public health physician. Thank you for joining us.
Thank you so much.
From across the state in Nigeria, they continue to adopt varying measures to curbing COVID-19. We begin in Kaduna State, the Ministry of Health confirming that 16 of the 17 new COVID-19 cases in the state are Almajiris who came in from Kano. The ministry also clarifies that one of the 17 cases announced by NCDC is a fresh positive case, a repeat test from an existing patient. The government reports that the 16 positive results are from a sample of 40 persons. Senior Executive calls 42 participants at the National Institute for Policy and Strategic Studies, Karu, Plateau State, have been engaging in high-level discussions through the crisis game strategy in relation to COVID-19, with the responsibility to provide government with evidence-based policy options and recommendations needed to cope with the pandemic. The Cross River State Governor has called on the federal government to discontinue the lockdown policy across the nation in an attempt to contain the spread of COVID-19 and improve its productivity, saying as the idea of locking down vibrant young people with so much potential and energy may have a catastrophic effect on the nation's economy. And following the record of an index case in Nasarawa State, the government has established 6 more sample collection centers, in addition to hospitals already taking samples of the 3 categories of risks associated with the COVID-19. Governor Abdullahi Sule explains this after inspecting the 300-bed isolation centers at different locations in Lafia, the state capital. And finally, the wife of the Enugu State Governor, Mrs. Monica Ogwanyi, has donated relief items to the less privileged across 17 local government areas of the state to cushion the effect of the lockdown. Distributing the items, she stated the gesture was informed by the importance of personal hygiene, particularly hand washing in fighting against the disease. And over in South Korea, which was once one of the biggest coronavirus hotspots in the world, it's recorded 0 locally transmitted cases over the past 24 hours. 4 imported cases have been recorded, all of which were found at airports, bringing the number of confirmed cases to 10,765. According to the Korea Centers for Disease Control and Prevention, it's the lowest daily increase in over 2 months. And how do you practice social distancing? The Nigeria Center for Disease Control has those measures. It says non-contact greetings, maintain at least 2 meters between yourself and others. Stay home if you feel unwell. Call your state's hotline as well. The World Health Organization has rolling updates on the plans. Each moment it's updating the number of cases and the number of deaths. That's our COVID-19 update at this time. Thank you for watching. Another update comes your way again at 6 p.m. In the meantime, our website has the latest. Log on to www.channelstv.com. I'm Innocent Momoka. Bye for now.